Practice Test 1 to 200 Certified Medical Assistant National Credential Review. Nationally Registered Certified Medical Assistant National Credential Review. 1. A patient with a rapid pulse has bradycardia. False. Water-soluble vitamins are A, D, E and K. False. 3. Carbon dioxide is a waste product of metabolism. True. 4. Some states consider it legal for medical assistant to diagnose a condition and prescribe treatment. False. 5. It is illegal for a patient to be denied a copy of his chart if he is unable to pay the fee to obtain it. True. 6. A physician cannot be held responsible for the actions of employees. False. 7. A substance used to impart color to tissue or cells in order to study and identify microscopic organisms is called a stain. True. 8. Another name for a heart attack is myocardial infarction. True. 9. A properly collected sputum specimen should contain both mucus coughed up from the respiratory tract and saliva. False. 10. The most reliable and timely method of transporting microbiologic specimens is pickup by the laboratory. True. HEPAT stands for root of kidney. False. 12. A medical assistant needs additional training to be able to perform microbiologic tests, such as sensitivity tests, and to interpret cultures of specimens. True. 13. Viruses are found in soil. True. 14. The process of blood cells clumping together to form a clot is coagulation. True. 15. Water contributes about 60% of body weight. True. 16. The lowest level of organization for the human body begins at the chemical level. True. 17. The law requires all employers to withhold money from employees' net earnings to pay federal, state, and local income taxes. False. 18. Carbohydrates, lipids, and proteins are examples of compounds. True. 19. The optimal temperature to promote growth of bacteria in a culture medium is 37 degrees Celsius. True. 20. Bacteria that stain purple are gram-positive. True. The dorsal cavity is located in front of the body, posterior the back near spinal cord. False. 22. Neoplasms are new growths and are cancerous, non-cancerous. True. 23. The ventricles have one-way values at their entrances and exits so that blood goes in the proper direction as the heart pumps. True. 24. A living will is intended to help families of terminally ill patients deal with the inevitable outcome and limit unnecessary medical costs. True. 5. A copayment is a fixed percentage of covered charges after the deductible is met. False. 6. All medical practices have to cover workers' compensation cases. False. The study of all factors that cause disease is known as etiology. True. A check from an insurance company includes payment for only one patient. False. Calcium in milk can diminish the absorption of some antibiotics. True. Compounded interest is paid on the initial investment and on the interest earned on the investment. True. An employer must pay FUTA tax if employees' wages total more than $1,500 in any quarter. True. Vesting means that you have a legal right to all the money in your account. True. Trichinella spiralis is a roundworm that enters the body in infected meat eaten raw or undercooked. True. In a medical practice, accounts receivable describes the money that is paid out to run the practice. False payments made by a patient represent the doctors as accounts receivable. A customary fee is the fee a doctor charges for a service or procedure. False. The physician usually authorizes several people to handle the purchasing of supplies and other products. False. Infarction is an area of dead tissue caused by an invasion of bacteria or loss of blood supply. False. Heart attack. The percentage the employer pays for federal unemployment taxes decreases if the employer also pays state unemployment taxes. True. And treated strep throat is not serious and does not lead to complications. False. Metabolism is the sum of all cellular processes that build, maintain and supply energy to living tissue. True. The daily recommended allowance for fat in the adult diet is 50% to 60%. False. The typical American diet contains 2 to 5 grams sodium daily. True. Most fungi do not cause disease in humans. True. Encephal means neck, means the brain. False. Cyst means bladder. True. Cephalalgia. The medical term for headache, pyrexia. fever, hyperplasia, excessive tissue, hypoglycemia, low blood sugar, variola, smallpox, arthro, joints. Cytologist, one who studies cells, thoracotomy, incision into the chest, hypodermic, underneath skin, atriomegaly, enlargement of the atrium of the hearts, cardiac cycle, one complete heartbeat, combining the contraction and relaxation phases, resection, cutting or removal of a portion of, hypodermic, another term for subcutaneous injection, assault and battery. In performing a treatment without the patient's informed consent, the physician runs the risk of a suit for. Statute of limitations for malpractice suits varies. 1 year. Subpoena. A court order for a physician to appear and testify. Criminal offense. For anyone to practice medicine with a license. Malpractice. Negligence in medical profession. Respondent superior. An employee who is considered to be acting on the doctor's behalf while performing professional tasks. Physician's public duty. A physician reports a case of acquired immunodeficiency syndrome aids to the state. 18 years. The age of majority in the most jurisdictions. Ethics. The study of values or principles governing personal relationships, including ideals of autonomy, justice, and conduct. Average number found in 10 fields. When performing a microscopic, the evaluation of each element present in the urinary sediment is based upon the 10,000. When doing a red cell count, factor by which the cells counted are multiplied. 10x. When focusing the microscope, one should begin with which objective? Observing the color and character. The macroscopic examination of urine consists of 20 or 21 gauge. The appropriate gauge needle to use when performing phlebotomy of veins in the forearm. 50. When using a standard white blood cell pipette for determining a white blood cell count, the total number of cells counted is multiplied by. Gram stain, the most common bacteriology stain. PAN lateral. The most common position for chest X-rays are whether a bacteria is gram-positive or gram-negative. Gram staining is done to determine Q wave. On a normal X tracing, the first wave to show downward deflection. Systolic pressure. The first sound heard when taking blood pressure. Normal oral temperature is 98.6 F, the equivalent Celsius temperature, 37.0 C degree. Ultrasound waves are disrupted by air and gas. Ultrasound is commonly given with electrical stimulation, monocytes. The largest white blood cells are 19 gauge. Which of the following needles has the widest lumen? Subcutaneous. An injection into the tissue between the skin and muscle. Epithelium. The layer of cells forming the epidermis of the skin and the surface layer of mucus and serous membranes. Melanocytes. The epidermis contains strata. Several layers. Afferent neurons. Neurons that carry impulses toward the brain or spinal cord. Deoxyribonucleic acid DNA. A large molecule which is the main constituent of chromosomes is referred to as deoxyribonucleic. Oxyhemoglobin. Red blood cells appear red due to the presence of sympathetic and parasympathetic nerves. The heartbeat is normally regulated by the median or sagittal plane divides the body into left and right, prone position, face down, supine position, flat on their back with palms and face up. Proximal is the opposite of distal, coronal. The body is divided into front and back, dorsal. The opposite of ventral, proximal. The opposite of distal. The number of bones in the body, 206, femur. The longest bone in the body. Tissue are composed of cells, tricuspid valve. The valve located on the right side of the heart. Semicircular canals. Canals in the inner ear that affect equilibrium. Mediastinum. The area between the lungs that contain the heart, trachea, esophagus, and thymus gland. Osteoclasia, the surgical breaking of bones. Neuralgia, pain over the course of a nerve. Digitoxin and quinine. Which of the following are examples of plant-derived drugs? Thyroid hormone and insulin. Which of the following are drugs derived from animal substances? Potassium chloride. Which drugs is derived from a mineral source, KID? The abbreviation used to indicate that a medication should be given 4 times a day. QH. The abbreviation for every hour is absorption. Is the process of converting a drug from its dose form, such as a tablet or capsule, into a form the body can use. Metabolism. The process by which drug molecules are transformed into simpler products. Generic name. The following is considered a drug's official name. Inscription. Which part of a prescription includes the name of the drug and the amount? Transcription. Which part of the prescription contains the patient's instructions? What would you do to secure the handling of prescription pads? Suggest that the physician write prescribed amounts of medication in both numerals and words. The action of antihypertensive drugs is to reduce blood pressure, TID 3 times a day, PRN, as needed, LMP, last menstrual period, OD, right eye, HCT hematocrit, CA, carcinoma, QOD, every other day, MCG, microgram. When performing a finger puncture, the first drop of blood should be wiped away. The packed red blood cell volume is determined by performing a hematocrit. When using white blood cell count, the total number of cells counted is 100. The time the film is allowed to remain in the fixed solution is twice as long as the developing time. The most common place to take a pulse is at the radial artery. When applying a cast plaster, it is applied over a stockinette. If a carotid pulse was taken, it was taken at the neck. Palpitation is done by feeling a part with the hand. A patient is bleeding heavily from a wound on the forearm. You should apply direct pressure. The normal pulse rate for children from 1 to 7 years of age is 80 to 120. The normal pulse rate for children over the age of 7 is 80 to 90. The normal pulse rate for adults is 60 to 80. The process of measuring as done in chest expansion is called mensuration. The medication for injection should be verified at least 3 times. The appropriate way to dispose of a syringe and needle after giving an injection is to dispose in leak-proof, puncture-resistant container. The most common exposure incident a medical worker may encounter is accidentally sticking oneself with a used needle. The first modern health insurance became an employment benefit because a group of school teachers in Dallas TX joined forces and requested it. Law of probability. The underlying principle of all types of insurance is Medicaid, a program of medical care for the needy provided by the Title 19 of Social Security Amendments of 1965. Group coverage. An insurance contract written for a company for its employees. Persons who are unable to pay for medical care or who have dependent children may have Medicaid deductible, a fixed dollar amount the subscriber must pay or meet. In a typical medical practice, insurance claims are filed 7 to 10 business days from the date of service. Accounts receivable. Payments made by a patient represent the doctor's. Dollar entries made on the left side of the ledger are debits. Any check received for the doctor should be immediately given a restrictive endorsement. A patient's financial account is referred to as ledger or ledger card. One way to prevent patients from forgetting future appointments is call day before appointment. Use appointment cards. Don't book more than 2 weeks in advance. The 3 main groups of carbohydrates, monosaccharides, disaccharides, and polysaccharides. An inadequate supply of essential nutrients in the diet may result in malnutrition. Comprises about 60% of the body's weight. Water. Blindness can result from a severe lack of vitamin A. The vitamin that is necessary for proper clotting of blood is vitamin K. Good source of vitamin C are citrus fruits. A microorganisms is a tiny animal or plant. A typical of a food allergy is hives. Iron is known to be necessary component of hemoglobin. Fat-soluble vitamins are slower than water-soluble vitamins to exhibit deficiencies. The amount of energy needed to raise the temperature of 1 kilogram of water by 1 C is a calorie. Most essential nutrient for building and repairing cells and tissue. Protein. Each gram of contains 4 calories. Protein. It is recommended that what percentage of an individual's total caloric intake be made up of carbohydrates, 50 to 60%. Which of the following are used for immediate fuel and are converted to glucose? Carbohydrates. After the body's carbohydrates reserves are depleted, which of the following does the body burn? Lipids. Which of the following is the daily recommendation of fiber for adults? 20 to 30 milligrams. The recommended daily adult cholesterol intake is no more than 300 milligrams. Which of the following are saturated fats? Coconut and palm oil. The most important nutrient that is essential for the production of red blood cells is iron. Which vitamin is an intracellular antioxidant, maintains cell structures, and aids the formation of red blood cells? Vitamin E. Which vitamin builds bones and teeth, is found in egg yolks, butter, and fortified milk? Vitamin D. Vitamin is rich in citrus fruits, mangoes, strawberries, and green leafy vegetables. Vitamin C. The following maintains fluid and acid-base balance, and its main dietary source is salt. Sodium. Which of the following is important in the maintenance of muscle contraction and is found in foods such as bananas, raisins, oranges, and potatoes? Potassium. A condition in which the heart is unable to pump adequate amounts of blood to the tissues and organs is cardiac failure. A quick rising and collapsing water hammer pulse is characteristic of aortic regurgitation. Diabetes mellitus is a disease that involves the pancreas, carcinoma, a malignant tumor, hypertension, high blood pressure, arthrosidosis, an abnormal increase in red cells. Pathologist. One who studies disease, osteoarthritis, inflammation of the joint and bone, sternum. A lift or heavy is the rise with each heartbeat. Hypertension in the adult is defined as blood pressure greater than 140/90ths mmH. An inflammation of the skin usually causing itching and sometimes accompanied by scaling or blisters is eczema. Which of the following may precipitate individual attacks of asthma? Volatile irritants from organic solvents, exposure to mists and dusts in individual plants, inhalation of cold air. Anemia. A condition indicating that certain elements are lacking in the blood. Osteoporosis. A metabolic bone disorder affecting primarily postmenopausal women and is characterized by the loss of calcium and phosphate from the bone. Rheumatoid arthritis. What chronic inflammatory disease attacks joints and surrounding tissues and is intermittent with periods of remission? Impetigo. What contagious, superficial skin infection is usually seen in young children? Diabetes mellitus. A chronic disease of insulin deficiency or resistance is renal failure. A critical illness resulting in the sudden cessation of kidney function is sickle cell. Congenital anemia occurs primarily in African Americans and about 1 in 10 carry the abnormal gene called. The most potent stimulus to increasing coronary blood flow is called local myocardial hypoxia, pathogenic. The term for disease-producing